in light of the failed attempt, the sort of failed attempt, the maybe disingenuous attempt in some respects to get single payer going in California, here is Bernie Sanders on CNN with Jake Tapper. And there was a really good piece in the New Republic by Brian Beutler, which outlines how he says, look, if you spend time on Twitter, you may not be aware of what's actually going on the left. You may have a heightened sense of the dynamic. But broadly speaking, the Sanders part of the party, if we can call such a thing that, is fighting to protect the Affordable Care Act because they are rational enough to realize how much suffering is going to come. They're still looking to improve it. But here is Bernie on with CNN.
I want to ask you, first of all, when you were on this program in March, you said you were going to introduce your Medicare for All bill, which would also explain how to pay for it. You haven't introduced it yet. Is there a time frame for that? Because I think the American people, especially people who want to hear about your plans for single payer, want to know how exactly it can be paid for.
Sure. And the answer is we are going to introduce it literally as soon as we're through with this debate. I don't want to confuse the two issues. Medicare for All, which is simply an expansion of Medicare, it's not just the seniors, but for everybody, will be saving middle-class families substantial sums of money, and it will be guaranteeing health care to every man, woman, child in this country. Right now, though, I want to say, short term, if we're going to improve the Affordable Care Act, this is what I think we should do short term, while we go to Medicare for All longer term. Short term, you need a public option in 50 states. So if people are not happy with their private insurance, they can get a public option. Short term, we should lower the age of Medicare eligibility to 55 years of age. And short term, I hope we can work with Republicans to end the absurdity of us paying the highest prices in the world for prescription drugs. Longer term, we need a Medicare for All, and I will introduce that as soon as this debate is over.
Now, understand how much sense this makes both strategically and tactically, right? Just because the Republicans, the idea that the Republicans could just, would destroy the Affordable Care Act and then we would immediately get single payer is just nonsense. But more importantly, what Bernie is doing is he is maintaining his central role in the argument. And the way that he is doing that is by acknowledging that I don't want there to be an excuse that the reason why the Republicans were able to destroy healthcare was because I was advocating for something that couldn't possibly happen. And obviously not just himself, but broadly speaking. He's engaging in the fight that exists right at the moment while reserving the right to have the fight that he wants to have later. And what's interesting about this is the Republicans now have a real dilemma because it's almost gone so far that even if they weren't to pass this repeal and replace, which I still think, if I had to say, it's a greater than 50% chance. But even if they weren't, and they were to wait, essentially, and to continue to sort of degrade Obamacare by executive action and by state action, it's still going to be on them. There's still going to be arguments on how to improve it that will resonate, that Sanders has just suggested. Dean Baker did some work on where Obamacare is supposedly collapsing. There are more than 1,300 counties across the United States that have only one insurer operating in the exchanges, some that will have will have none in 2018. Now, as you know, you can buy individual insurance off of the exchange, but you're not eligible for the subsidies. And if you're not eligible for the subsidies, most people can't afford them. Because if you're only making up to 400% of the poverty line, you're just not going to be able to afford it. I heard some right-winger on, as I was driving out of New York Friday, filling in for Sean Hannity, bemoaning the fact that in New York State, New York City, I think in particular, you can be eligible for the Medicaid expanded under Obamacare if you are making $90,000 a year. Now, of course, what he doesn't mention is that's in New York City. That is for a family of 4. That is 400% over the poverty line in the context of the state. Because, of course, that family is probably paying half of their salary after taxes, maybe more, in rent. And the idea that a family of 4 is going to be paying another $20,000 after taxes in healthcare, but this is the way that they stick it. But anyways, so Dean Baker crunched some numbers. There are over 40 million people of the over the 40 million people in the counties with only one insurer. In the exchanges, they live in states with Republican governors. Just 10.7 million people who only have one insurer in the exchanges live in states with Democratic governors. However, if you adjust for North Carolina, which just had a Democratic governor elected, it becomes much worse for Republicans. Not including North Carolina brings down the number of people with one insurer in their exchanges in states controlled by Democratic governors to just 2.1 million people, as opposed to 48 million people. So almost 21% of the people living in states with Republican governors have only one insurer in the exchange. 1.8 of the people living in states other than North Carolina, controlled by Democratic governors, have only one insurer in their exchanges. So in other words, Republican-controlled states are destroying their health care and are not working to save or help Obamacare. Now, they don't have to do that, but it seriously undermines their story that it is collapsing under its own weight. That's quite an amazing coincidence. Hi, folks. Sam Seder here. We still need your help on our Patreon page. YouTube ads have come back, but not nearly as much as we had before. So if you can help us out, any little bit helps. Head over to our Patreon page right at this URL, and you'll help us keep helping you by making videos